Hi, everyone. Welcome to my podcast and my YouTube channel. Today, we're going to have a different view of many of the clinicians that you have listened to on my podcast. Even though I hardly ever interview psychiatrists, I don't think I've had many. It's usually social workers or counselors, psychologists. And I'm sure the listener is going, what on earth is the difference? Because that's what we hear, right, Tamala.
That is correct.
People say, what is the difference?
Mm.
Psychiatrists, psychologists, counselors, social workers. Oh, there are just so many names. But anyway, today I have here with me, and I'm really happy to have her on as my guest on my podcast, Aruna Tumala. She is a psychiatrist, but a very different one. And you will understand why. Because she just told me like 2 minutes ago, we were just chatting before the interview, and she said, my mission is to talk about this and to change the face of psychiatry. Because today, especially here in the US, and I have to say in Brazil is no different, Aruna, it's the same. It's all about medication, right? What are the symptoms? Let's treat the symptoms, stuff them up with medication and get rid of the symptoms, and we're treating them. So this is a very different approach from what she does. So that's what we're going to talk about today. She is holistic. And I know that this word holistic, we immediately think of India. And yes, she's from India.
Yes. Born and raised in India, actually completed my medical education and a psychiatric residency in India from my institute, my alma mater, National Institute of Mental Health and Neurosciences, which is in Bangalore. And then after that, I immigrated to the United States. I repeated my psychiatric residency here at the Medical College of Wisconsin. And after that, I completed a 1-year fellowship in geriatric psychiatry. So I'm actually trained in geriatric psychiatry. And then I became a mother.
And that kind of changes everything, doesn't it?
It changes everything. It changes everything.
Because
So,
I'm not a mother, but I would think that especially if you're a doctor, I think you look at your kid and you go, what do I want for him or for her in the future in terms in your area psychiatry? Do I want this to be the same, or would I want to be an agent of change? And that's the option you took, and that's what we're going to talk about. We're going to talk about medication, the ups and downs, the pros and cons. And of course, before we even forget, I don't want you guys to, after this interview, to stop taking your medication because, oh, maybe that's not a good thing for me. And we will touch on that too. But first of all, Aruna, tell me about your story. What brought you here after you finished your training in psychiatry?
um, so so really what happened was when I was doing my second residency here in the US, the seeds of what I think, the way I think and practice were definitely sown in India. My training in, especially my psychiatry training in India, was always about the mind and the body together. So much so that our degree was called neuropsychiatry, because it was impressed upon us that we don't understand why mental illness happens, but at the very least, we know that different body diseases, and especially neurological diseases, can cause mental illness. So in India, if I did not do a complete physical exam, including a neuro exam, and if needed, if I did, I could get a CT scan of the head to look at, are there any tumors or is there any bleed happening within the brain? If for anyone, if I suspected, the person could be presenting with psychosis, but I had to do the preliminary investigation, first rule out physical causes in the body and in the brain
Wow.
before I could say that this person is purely psychiatrically ill. So that was my training, actually. So really my training in neurology, my experience and expertise in neurology was really very fine tuned. And then I come here and I cannot, on my first day, everybody knew I had to just repeat my residency because, US the American Board of Psychiatry did not recognize my Indian degree. So I had to repeat my residency. But everybody in the residency program knew that I was a practicing psychiatrist back in India. So on my very first day, I was assigned to the mental health inpatient unit. And there was a first year psychiatry resident and a medical student that was posted along with me. And the attending tells me, "Hey, Dr. Tumala, you already are a psychiatrist. Why don't you demonstrate how you do a psychiatric evaluation?" So, okay, I said, "Yeah, okay, fine, I'll do it." So I started to talk to the patient, went over the questions, and, I had a little bit of an idea. And then I got up with my stethoscope and my knee hammer, and also had a fundoscope. This was considered very important back in India, is that we look in the eyes to look for raised intracranial pressure, because that is one of the first indications of a tumor. And I've diagnosed people with, would present psychiatrically, but would have these kinds of conditions. And it wasn't often, but, back in India, I had diagnosed somebody who had come with anxiety, but she actually had thyroid cancer.
Mm,
Somebody with psychosis that actually had neurosyphilis.
mhm,
So, and another patient who presented with psychosis, but she actually had pseudotumor cerebri, which is a condition where the pressure in the brain increases without
mhm,
actually having the tumor. And the treatment for all these conditions are very, very different. Yes,
mhm,
we may give them medications, but we also have to take care of the underlying neurological or physical disease.
mhm.
So on my first day here, I stood up to examine the patient, and the attending goes, "Wait, what are you doing?" And I'm like, "I'm examining the patient. I'm doing the physical exam." And he says, "Oh, no, no, we don't do that." And then, how are you going to rule out organic causes? "Oh, we have an internist do that. It's medical legal liability. You don't touch the patient." And to say that
Wow,
I was
that
shocked
sounds
is,
so American. It's a touch
and
phobic society.
yeah. But in India, like if I wanted, I would get chest x-ray, I would get a CT scan, blood work, everything. Like before diagnosing somebody with a psychiatric disease, I had all these tools at my disposal. So many times, first episode psychosis, I would always get a CT scan, because first episode psychosis, even in a young person, can be from a brain infection, or it can be from a tumor in the brain, or, things like that. So I felt very cramped. And the other thing that was very different is that there in India, we always admitted a family member,
Hmm.
because, of course, the staff to patient
Support,
ratio.
right? Yeah,
No, no, yes,
support.
not
Yeah.
that. But the idea was that the patient goes back to the family, and the family needs to know how to support and take care of the patient.
Wow.
And also the staff to patient ratio was very, very low. We had a lot of patients to take care of. So the
Mhm,
nursing, that also was a reason. But it was we got so much of good collateral information. We really understood the family system, worked with the family. Whereas here, especially in the hospitals, the family was not there. I mean, in fact, I was one of the psychiatrists that would always insist on doing a family session, because just with the patient you don't get the whole 360-degree view. But anyway,
mhm,
these were the two things. But then, as I became pregnant and I began to learn about all the toxins that are there in our food system and everything, I became very concerned about the effect of those toxins on my body when I was trying to get pregnant. So I had changed all of that,
mhm.
switched over to organic diet, tried to use only clean products, but still it was very much in the infancy. Then my children happened, and even more, oh my God, I'm not going to eat the food in the hospital. I was pregnant for the
Yeah,
second time, nursing. I would go hungry, but I would not eat the food in the hospital, because it was all processed, packaged, God knows
yeah,
what's there
yeah.
in everything.
Mhm,
And then I began to think, hey, if I feel that way, how is this food that my patients, I mean, they were eating the same food from the cafeteria. How is that affecting their brain? How is that affecting their mood, their mental health? And these questions actually made me go down the path of, ask Dr. Google, right? That's where we all start. And
mhm,
I came across lots of wonderful information, which I was not taught in both my residencies. Even, I mean, the emphasis on the importance of nutrition was not there. Like, how do you eat to improve your mental health? Don't know. That was not
mhm,
taught at all. But luckily for me, my research took me to an organization called American Board of Integrative Health and Medicine.
mhm,
It's called ABIHM. It's called Academy of Integrative Health and Medicine. I looked it up and I immediately signed up for a conference. I went for my first conference was in October 2013. And I was changed. I was like, I
Yeah.
came back with so much information.
That's when your mission became clear to you.
It became absolutely
Yeah.
clear. I knew I had to
Yeah.
do my diploma in ABIHM, and then I knew I had to do functional medicine. So ABIHM was a mixed bag. I was introduced to Chinese medicine, Ayurvedic medicine,
Mhm.
functional medicine, and you could pick what spoke to you. So I picked functional medicine and Ayurvedic medicine. And then within 6 months, I got my diploma in ABIHM, and I started my training in Ayurvedic medicine and functional medicine. Couple more years later, so by 2015, I was done with this, and I felt confident in incorporating uh, this new way of thinking, and everything I began to question. So where is the evidence for chemical imbalance? Is there really a
Mhm.
chemical imbalance? And when I went and looked in the research, there
There's
is
no proof.
there is
Zero.
no
Yeah.
there is no proof. And again,
Yeah.
and not only me, there are many researchers like Dr. Joanna Moncrief, David Hayes. These are people from UK. Right here in the US, there's Irving Kerr. She's a psychologist who's done a lot of studies about that majority of the treatment response that we think antidepressants are causing is actually the placebo response. You cannot differentiate it from the placebo. This is Irving Kirsch's work. And then
Mhm.
Peter Gosia, who's a Danish physician, and he was the founder of Cochrane, he
Mhm.
wrote many, he did a lot of meta-analysis about different psychiatric drugs. And he has
Mhm.
actually come out and said that less than 2% of psychiatric drugs are actually useful. And the
Mhm.
remaining 98% are at best just useless, but at worst, they cause grievous harm in terms
Mhm.
of side effects, in terms of actually increasing psychiatric morbidity, meaning that a person that is exposed, especially to antidepressants, actually experiences more depression episodes. It reduces stress resilience. It makes the person unable to cope with life. It
Mhm.
increases rates of disability. Robert Whitaker is a journalist. He's written a book called Anatomy of an Epidemic.
Yeah, I've
And
read that book. Yeah.
yeah, it's a every mental health professional should read that book. And I make it a compulsory reading for my patients because they
Mhm.
need to understand the actual evidence that exists, that none of these medications work. I mean, so in my practice, I would say less than 1 to 2% of patients, I put them on medications.
Mhm.
And that too mainly in psychosis, and never medication alone. So then
Mhm.
then the question is, okay, then why are people having all these diseases,
Mhm.
right?
Yeah, but that's the main thing, right? And one thing that I want to ask you, I read, I think it was on your blog that you said, oh, the chemical imbalance. Let's just start there, right? We actually just had this very controversial article, very recent, right? And I mean, all the media is all over it, talking
Yeah.
about depression and serotonin. That finally they had this very comprehensive review, and they came to
Yes.
the conclusion that this idea that it's lack of serotonin or low levels of serotonin that cause depression. No, it's not
No.
that, and it's now proven that that's not it. So it's
Yeah.
really not chemical imbalance. But my thing is, so we have our listeners now, many of them are dealing with mental health issues. They have depression, they have anxiety. I mean, let's not even go there with the pandemic and everything. And
Mhm.
many of them are taking medication. And of course, I don't want them to listen to this and go home and say, throw it in the trash. So,
No.
what options do they have in this, especially here? Because I know that like 70% of my listeners are here in the US. And if they go to the doctor, as you said, they're very linear, they're symptom based.
Yes.
It's all
Yes.
about the symptoms and it's all about medication.
That is
So,
correct. Yeah.
yeah, so what can they do? Because that's what they're going to get.
Yes. So here's what I mean with the training in Ayurvedic medicine and functional medicine and my own clinical experience. What I have found, my insights are that there are only three root causes for any disease, literally physical or mental illness. It's bad diet, it
Mm-hmm.
is trauma, especially early life trauma. Both physical trauma, like
Mm-hmm.
head trauma, is a big factor for many mental illnesses.
Mm-hmm.
Mild concussions can be very causative. And number three is toxins. So this is the trifecta. It's bad diet, trauma, toxins, these three things.
Mm-hmm.
And
And bad
what
diet and toxins are related, right?
Yes, yeah, but toxins have an independent effect in addition to
Okay.
the wrong diet or the bad diet itself.
Mm-hmm.
And when I say bad diet, what I mean is actually the standard American diet, which is processed, high in sugar, franken chemicals, all kinds of chemicals that are basically preservatives. They don't have any nutritive value. And to extend the shelf life, and I mean, like, all purpose flour, there's nothing in it. All purpose flour has, and most of the breads or, any packaged food that you find is made up of cornstarch or high fructose corn syrup. These are all, they don't really have any nutritive value to it. And in creating all these things, they have to add, the companies have to add many different chemicals, not even artificial flavors, artificial dyes. All of these are chemicals without nutritive value. So the
Mhm.
diet is low in nutrition. That's one problem. The second problem is the toxins that we are exposed through food. And I'm not even talking about the pesticides and the herbicides, but then chemicals that we put on our body through our makeup, through our toothpaste, the face care, body care, hair care products, deodorants, all of this, the chemicals that exist in them, they have a dual effect. One, they're directly stimulating or aggravating to our immune system. Our immune system gets aroused, and not in a good way.
Overworks,
It
like
gets overworked.
overworks.
But
Mhm.
these are chemicals. The immune system is trying to fight a chemical, but it's not a biological agent. So it cannot really make an antibody and neutralize it, but then it just stays in our bodies and constantly triggers this inflammation. The second way that it causes damage is that many of these chemicals, especially, and to your listeners, anything that you use that has a chemical fragrance that's made of phthalates or parabens, they're all endocrine disruptors. They mimic your estrogen, which is why we are seeing PCOS, acne, low sperm counts, and infertility in both men and women.
Mhm.
All of these, so it's all interrelated. Our
Mhm.
hormonal imbalance causes mental illness, and these three things, the diet, trauma, and toxins, the first thing that they do is they damage our gut lining, the leak, which
Mhm.
and causes
Yeah.
leaky gut. Leaky gut
Mhm.
is the first step in the formation of any disease. And when the gut becomes leaky, it allows the bacteria from the microbiome, especially the bad ones, to to enter through the gut lining into our bloodstream, triggering inflammation. It
Mhm.
allows toxins that are in our gut, in the gut cavity to enter. And the second thing is that when the gut lining is weak, now these cells cannot make digestive enzymes, so our food doesn't get digested, so we develop malabsorption syndromes. And so the always, I mean, with every patient, Paula, when I take them back in time to the earliest time they became sick, almost always there is either, in fact, as far back as infancy,
Uh-huh.
these people in adulthood, when they're experiencing depression, anxiety, they start off with colic as infants.
Mm. Makes
Then,
sense.
yeah, then stomach pains, ear infections. But the gut, role of the gut is so clear when we actually do a timeline of all
Mhm.
symptoms.
That's so interesting.
Yeah.
Yeah. Yeah. I I actually, and the second one too, I'm sure you listen and you know of
Mm-hmm.
Mode. What is his first name?
Gabor Mate.
Gabor Mate. Gabor Mate.
Yes. Yeah.
I've
Yeah.
read his books and I listen to him a lot, and his focus is on trauma, right? But he has
Yes.
a
Yeah.
very, very similar point of view as
Mm-hmm.
you. I mean,
Yeah.
no, it's not about medication. It's about the trauma and going back to the root
Yes.
of that trauma. And of course, his area of expertise is addiction, which is
Yes.
now, of course, so that you can get treatment in this country. It's a disease, and he's going, no, it's not a disease, it's actually
It's
a
a response.
result of trauma. Yeah, it's a
Yes.
response to a trauma that was not processed or treated
Yes.
or whatever you want to call it.
Yeah.
So you're talking about nutrition, so let's talk about trauma. How does that impact your health?
So, and this is how I came to it, from a functional medicine and Ayurvedic medicine. Everything that I'm talking about, 5,000 years ago, the ancient seers of India wrote it down that leaky gut is the first thing that
Yeah.
happens. And also, they said the number one root cause is actually what they said is a mistake that the that our mind makes. And what is that mistake is that we are not worthy.
Hmm.
When I first read it, I was like, I just glossed over it. And then
Mm-hmm.
because I was so focused on healing the gut, it was bringing in results. But then as I was talking to my patients, trauma kept coming up, trauma kept coming up, trauma kept coming up.
Mhm.
And then when I put the two and two, what I was reading in Ayurveda and here, and of course, the studies now in modern medicine also show this. So the pathway is that when there is that early life trauma, what it really makes the child feel is that she or he is not worthy,
Yeah.
and it results in a sympathetic overactivity, the chronic stress response, which is the cortisol response. So
Mhm.
because now the child, because of that inability to feel valued and worthy and attended to, it gives rise to a state of inauthenticity where the child is constantly trying to modulate herself to the needs of others in her environment, at
Mhm.
the sacrifice, by sacrificing her own authenticity and individuality and her own self-worth.
Mhm.
So this, I mean, from a psychological standpoint, we call it, as adults we say, oh, she's just borderline. No, what is actually happening is, this is what I don't like the word borderline either,
No,
because
it's
it doesn't,
very
and
the
it's
stigma
become
is
very,
huge. Yeah.
yeah, it's actually chronic PTSD, is the fear of rejection, abandonment, the
Mhm.
over idealization and devaluing that we see can all be explained on the basis of that early life trauma that does not allow a child to become whole and
Mhm.
authentic and
Yes.
learn how to value themselves
You're always alert and always trying to prove yourself, always afraid of everybody because you think you're going to be abandoned at any time because
at any
you're
point in time.
worthless in any way. So
Yeah,
again, it's the parasympathetic, overworking and overworking, a lot of
sympathetic.
cortisol. Yeah.
Yeah, sympathetic. And then how the body gets pulled in is that cortisol is not only toxic to our brains, it eats away at the hippocampus, which is why many children that experience childhood trauma have very patchy memories of their past. That's a
Hmm.
big indicator that there was trauma. When they say, oh, I don't really remember my childhood all that much.
Hmm.
Yeah, I remember. That's an indicator that there was trauma there. But the second thing that cortisol does is that it's toxic to the gut lining. So
Oh,
there again, we
there
see,
again, you go to the gut.
there
Yeah.
again, we see it goes through the gut.
Yeah.
And so these are the two root causes. One is that lack of self-worth, and the second one is the leaky gut and the
Mm.
inflammation. Then the microbiome gets disrupted, malabsorption syndromes. And so what happens is that on the one hand, you're not getting the nutrition to support functions within the cell. Every cell in our
Mhm.
body needs the nutrition to do its job, and so the cells are not functioning. Your liver is not detoxing. Your brain is not making neurotransmitters. Your heart is not pumping very well. Every organ your
What do you
hormones are.
expect, right? And you don't know why you're feeling depressed.
Yeah, exactly. And then we
Right?
say, oh, the neurotransmitter levels are low. No, it's just the tip of the iceberg. And even there, because our cells are still trying to do their job, the reason why this study by, the one that you quoted is by
Mhm.
Joanna Moncrief, why they don't really find these serotonin imbalances, because our bodies are still trying to make the best of the situation. So it's not that they're in a chronically low state of serotonin. It's not that. So that is something to even keep in mind. And then I lost my train of thought a little bit, but
No,
basically,
yeah.
so each
No,
cell.
yeah, let me just you were talking about the one of the first signs is this patchy memory of your childhood, and I was immediately taken to my first session with a psychologist. He was a psychologist. I was in my late mid 20s, and I remember the first session he started asking me all these questions about my childhood and about my parents, my grandparents. All I could do is like, oh my goodness. My mind was like, no, no, I didn't know a thing. Couldn't answer one question. And he said, okay, so here's where we're gonna start. You need to recover that memory. You don't know anything about your childhood.
Yeah.
And I was like, yeah, I really don't. And most of it I still don't.
Yeah, I mean, you see, there is a dual function here. Because of that, when you are in that stressed out state, you become hyper focused on the immediate situation. So you're not able to, you're in a survival mode. It's the
Mm-hmm.
amygdala
Yeah.
activation, it is
Mm-hmm.
sympathetic cortisol activation. And also, there is a protective function. When the environment is so threatening, you don't want to remember everything about it.
Mm-hmm.
Like
Mm-hmm.
other acute trauma survivors, whether it is of rape or mugging, they also cannot remember because it's a survival mechanism. We don't want to remember everything. And
Because you can be re-traumatized, right?
you can be, yeah, you can re-traumatize yourself. I mean, that's what the nightmares are about, and flashbacks and all of these things. They're pretty traumatizing. And
Yeah.
sometimes this trauma therapy work, I mean, I do believe that once you have to kind of unburden and unload your past history of trauma, but after that we have to focus on healing in the present moment. That's
Mhm. Mhm.
so really for your listeners, my biggest advice is that no, please don't stop your medications, because psychiatric medications are highly addictive.
Mhm.
Everyone will go through a withdrawal, whether you're taking an antidepressant or an antipsychotic or an anti-anxiety, they all cause withdrawal. And
Mhm.
when you are physiologically, when you're toxic, when you have inflammation, your body cannot go through a withdrawal, a sudden withdrawal. So in my
Mhm.
practice, what I do, we first institute our treatment. We reduce inflammation, start the detoxification, teach sympathetic and parasympathetic balancing techniques with meditation and breath work and all of those things, which, by the way, doesn't take long. Takes
Mm-mm.
about 3 to 4 weeks. I mean, some people, most of my patients report 30% improvement in 2 to 3 weeks of starting our protocols.
Wow. Wow, that's
It
huge.
doesn't take long. And then by about the 4 week appointment or 6 week appointment, we do talk about coming off of the medications, and we
Mhm.
do it in a very gradual manner. Recovering is very, very easy. That's one thing I want your listeners to know.
Mhm.
We can I mean, my oldest patient, she came to me when she was 72 with 40-year history of uh, no, actually 50-year history of irritable bowel syndrome, diagnosis of anxiety, depression, and she was on antidepressants for 40 years. um,
Wow.
yeah,
And you
but
were
she
able to taper off the medication?
she is completely, I mean, number one, we reversed her IBS, irritable bowel syndrome.
Mhm.
Then she got better from her anxiety and her depression, and then the last thing was we tapered her anti. She was on like 225 milligrams of FXR, so we took almost I want to say 16 months. We took. I mean, she was in no hurry. She was like,
No, of
and I
course
was
not.
like,
Yeah.
no
Yeah.
hurry, no hurry.
And
And
it
she,
will take time after 50 years of taking antidepressant
yes,
and
yeah,
psychiatric medication, of
yeah.
course. Yeah.
And we support, we you have to continue with the detoxification, the nervous system balancing therapies, and also I do use certain supplements that specifically depending on the medication that we are tapering off, we do, I've come up with protocols that we can help. But the first thing always for all my patients is to do an elimination diet for at least 3 months. So number
Mhm.
one, no junk processed food. Go back to eating, just get real food and prepare. Of course, this, it you have to work towards it. And I
Yeah.
tell my
Okay.
patients,
Can we just clarify what is real food? Because people say, okay, I will stop eating at fast food places, and then they go home and they buy all this boxed and ready to go food. What is real food? Let's give them some ideas.
so real food is whole, unprocessed, meaning it has not gone through any kind of factory processing at all. So it would be meats that are not cured, they're not cooked. It's just raw meat, like chicken or fish or anything that you bring home and then you prep it and then you cook it for
Mhm.
yourself. The second thing would be vegetables, fruits, whole grains like rice or flour. Yes, you can get whole wheat flour, and different kinds of grains. Quinoa, rice, wild rice. Then lentils. Not even I don't even like to get canned beans. I get dried lentils and I soak them overnight, and that way you have the option of sprouting them, which is very nutritious, or you can just pressure cook them the next day and make a nice meal out of it.
Mhm.
So really a good way to think about is like when you're in a grocery store, just shop on the periphery. Don't go into the aisles at all.
That's a great tip. Yeah, because that's where all the boxes and cans are, right?
Exactly. Yeah. So, and anything, if you look at the ingredients and if you cannot pronounce the names, please don't buy. Yeah.
I had someone say that if it has more than five ingredients, don't buy
Mm,
it.
that's a good one too. That's a
Yeah. Yeah. So
yeah.
okay, so you start by working on your diet.
Yes.
What else?
So, I mean, let me tell what the diet is. It's no
Okay.
junk, no processed food. You're eating real food, whole food. Because when people have illnesses, any illness, their digestion is not healthy to digest raw food. I also recommend no salads. Now, everybody in the US is
Mm,
going, salads are healthy. What are you talking about?
yeah.
Talk to me if you need more information as to why that is. But actually, giving up salads, you can have smoothies, but salads are not at all good for you if you cannot digest them.
How
And
do you know
so,
if you can digest them?
if you have any symptom, you're not digesting.
Oh, okay. If you have like cramps or
No, no, no.
gas, no?
If you're struggling with any disease, your digestion is low. This comes from Ayurveda.
Oh, okay.
Your
Okay.
digestive fire will be not healthy if you're having any disease. So if you're having any chronic disease, acute disease, like for instance, when you fall sick with the flu, will you eat a salad, or do you want to have just brothy foods and all of that? See,
Mm.
this knowledge, this wisdom exists everywhere, but we don't connect the two. Why
Mhm.
don't we feel like eating salads and heavy meals when you're having the flu? Is because when your body is fighting the infection, there's not enough power in your digestive tract to digest heavy foods. So naturally, we gravitate towards easily digestible, brothy chicken soup kind of foods.
Yes, yeah. So
There
listen to
is,
your body, right?
yeah, really. And there is no difference between an acute disease like a flu and a chronic disease like depression or anxiety. The
Mm.
processes are the same,
Mhm.
except in an
Okay.
acute disease, it's maybe very amplified. In a chronic disease, the same thing. Like even in terms of the immune system, we have these immune chemicals called cytokines and chemokines. The same immune chemicals that get activated in an acute disease are the same ones that are getting activated in chronic disease.
Mhm.
So that's why I say no salads, but you can have any fruits, any vegetables. You can eat fruits raw, but no vegetables have to be cooked, sauteed, steamed, baked, however you like to, or you can make it into a smoothie and have it.
Okay.
Uh,
So no greens then. No
no
greens. No
gluten.
no leafy greens.
Yeah, but you can make it into a smoothie, is what I'm saying.
Okay. Okay.
Yeah.
All right. Can we talk about inflammation, because this is another
Yes.
area that I've studied a lot, and I'm
Yes.
really interested because I know there is some study now that connect mental illness to inflammation. And
Absolutely.
so what can we eat to avoid inflammation or to fight it?
So the first thing is what you can eat. If you're in a healthy state of if you're in a state of health, anything that is organic, non-processed, whole and real food, you will be able to eat and digest, especially if you're eating it seasonally. Like now we're going into fall and winter, please stop eating the melons. This is not the time to eat melons. This is the time to bring on the fleshier squashes, the pumpkins, the sweet potatoes, even organic white potatoes also,
Hmm.
no harm in that. All these complex carbs, because as we go into winter, we need more calorie rich foods to consume. So
Hmm.
as long as you're eating real food, whole food, unprocessed, no junk, and eating seasonally, then you will be able to keep inflammation in check.
Hmm. Okay,
But
cool.
always check with yourself, because we are
Hmm.
all different. What works for one person may not work.
Hmm.
But
Okay.
yeah,
Okay, the question I'm asking myself now, because I'm always trying to put myself in the position of my listeners, is, oh, they must
yes,
be thinking about this. Okay, so they have a doctor, they have a psychiatrist, they've been taking medication, and of course, they shouldn't stop it. But
yes,
where can they find people like you? Because they will go back to the doctor and they say, yeah, that's BS.
yeah.
Just go back, let's just increase your medication. So where can they find doctors like you?
See,
That's
I
the
think
big
functional
challenge.
medicine, yeah, I mean, you'll have to look for holistic psychiatrists or, functional medicine trained psychiatrists, something like that. But, I know I'm in the minority, unfortunately.
Hmm.
Like, I mean, I was just at a conference for health and wellness professionals. I think out of 400 people that attended, it was me, and I don't know if there was maybe one other person who was doing a slightly different form of holistic psychiatry, but hardly anybody. The
Mm.
holistic psychiatry is very much in the minority.
That's
So,
very
but
discouraging.
no, 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 not at all. I mean, that's why now there are many books that people can read.
Okay, great.
This
So,
Mark Hyman has written a book called The Ultra Mind Solution, that's a good one to read.
Mhm.
Parenting a Whole Child by Scott Shannon.
Mhm.
He's a child psychiatrist, and he actually practices in Colorado.
Mhm.
I think he's just outside of Denver. He's a child psychiatrist, and he's one of the first people that I learned from. Amazing. And
Mhm.
so, I mean, there are ways that you can still, but remember, healing from mental illness is first healing your body. So you have to, and the diet that I recommend, the elimination diet, that is the first step. So no
Mhm.
dairy, no gluten, no corn, no soy, and no eggs for about 3 months. That is absolutely critical.
Mhm.
So that is the first step to reclaiming your health and vitality.
Mhm.
And yeah, and I we do offer consultations online, so I do see
Mhm.
patients outside. We have a team that we can take on some more new patients if anybody's interested that
Yes, and can you do it in other states? Because in the US, it's all about the states, right?
Yeah,
Can
I
you
mean,
have
I offer,
patients?
yes, yeah, I do see patients outside of, because we don't, for the only difference is I don't prescribe medications for out of state
Mhm.
patients. You'll have to continue, but I will recommend a taper that you can continue with your provider. But
Okay.
everything else that we can to heal your body, to heal your trauma, we take care of that because,
Okay.
yeah,
Cool. Yeah.
6 to 9 months is the average duration that people need to spend for treatment.
Wow, I'll make sure to have all your contacts on the notes so people can contact you, your website,
Mhm.
telephone number, everything. But also, if you could send me a list of books and maybe
Yes.
websites
Yeah.
that people can
It's
go
all on
to
my it's all on my website. So
on your
all the
website. Would they
yeah.
find like leaflets on what to eat, what to avoid, and all of that? Would they find things like that?
Not that, but I'm actually coming up with a course. It'll take course for patients. That would be something that it'll take me
Yeah.
about 3 months, maybe a little longer than that to
Mm-hmm.
put the course together. I'm working on it because
Yeah.
yes, it is for this. I know I cannot work one on one with everyone, even
Sure.
even though I would
Yeah.
like
Yeah.
to.
There's so many people struggling and they want
Yeah,
answers. And many of them, they can do it on their own. They don't need to
exactly,
go to a doctor, but they need the information, the correct
exactly.
one, and
So
where to find it.
that's exactly what I'm working on, is to make a course where, and we will give you ways to kind of and it depends. I know some people need definitely clinical help, but even, I mean, the diet that I'm recommending, I would highly encourage all your patients, if they did nothing, just to go on the elimination diet. Of course, the first week you will go through withdrawal, and that's when you will realize how, I mean, if you,
How
it's
bad
like
it is,
withdrawal,
right?
how bad it is. Yeah.
Yeah.
So
Yeah.
you will go through
What does
withdrawal.
it look like? What does it look like, the withdrawal from all these processed foods?
Headaches,
Mm-hmm.
flu-like symptoms, sometimes throwing up. Irritability is a big one, but foggy brain fog,
Mm.
just feeling like you're coming down with something. Um,
Wow.
yeah, that's all inflammation.
I want to go to my pantry right now and just get rid of all the even though I eat quite healthy, I mean, comparing, but
Hmm.
still, it's hard because in this country it's hard. But I love what you say. Just don't go into the aisles. Stay in the
Yeah,
periphery. That's
stay
where
in the
the
periphery.
fruits
Yes.
and cheese. Well, you said no dairy. So okay, let me ask you something. You said no dairy and no gluten. What
Yeah.
if you don't have any reaction? Like me, I can eat dairy as much as I want. I can eat gluten as much as I don't have any reaction. So why should I stop?
See, the thing is, unless you've done an elimination diet, you don't know. I used to think that, and I was diagnosed with Hashimoto's. I had PCOS, polycystic ovarian disease, and what else did I have? I was overweight, and I was pre-diabetic. I struggled with infertility, so.
Wow.
But I don't have it. I mean, I'm 46, and I don't have. I was much sicker when I was in my 20s than I am now. I mean, I don't have these chronic
Hmm.
conditions. And my mom has rheumatoid arthritis, and I was developing symptoms of rheumatoid arthritis in my early 30s. But so in a way, me going down this path, I didn't realize how much it was going to benefit me. So I
Mm-hmm.
didn't realize that I cannot tolerate gluten. But again, so what we do at the end of 3 months is that we reintroduce in a very, so this is part of, the advantage to working with somebody like me, is that we reintroduce in a very clear fashion to see whether it works for you or not. And
Okay.
But in Ayurveda, what we say is that if you are eating real food and if your digestion is healthy, then you can eat anything as long
Mhm,
as you can digest. So most of our treatments in Ayurvedic medicine is geared towards restoring that digestive fire or digestive abilities.
mhm.
So once your digestion is restored, you will, even though you may not tolerate it right now, at some point in time, you will be able to. So most of my patients, they're not eating this diet forever. Only maybe autism patients really, they cannot digest dairy and gluten. Um,
Really?
yeah.
I didn't know
So
that.
yeah. So that is the so autism patients is one where I do caution the parents and adults with autism that they may struggle with it. That's one thing that we do see. But most of my patients are able to go back to consuming a little bit of dairy, a little bit of gluten, and they can, and definitely corn, soy, eggs, and everybody can reintroduce at the end of 3 months. So,
Mhm.
but during those 3 months, we have a very prescribed protocol with which we restore the gut lining, we restore the digestive fire. And
Mhm.
that's what we're
Okay.
doing. So it's not just eliminating and waiting. No, you have to do some things. You eliminate the bad and you provide the good. That's all we do over and over and over again until you become healthy.
Well,
So,
Aruna, you better finish that course.
yes, amen, amen.
Because
That is
you can find, of course, all this information is out there. Like you said, Dr. Google is there. There's so many videos, but it's all scattered, right? Because I know, because I was struggling with inflammation on my back for almost a year now, and I kept researching in food to anti-inflammation food, and you find one little video that tells you a little bit, and then another one that tells you a little, and you're going, yeah, but is that enough? Because it's so scattered. So we need someone to give us the ABC, the A to Z, not just the
exactly.
A, the F, the L, and the M.
I agree. I mean, for me too, it took me a good 6 months after all my, like in 2014, 2015. I remember I had all this, but even to implement that in my own home for myself and my family, it was a challenge.
It
It's a
is. It
challenge.
is.
Yeah, it is.
It is
So
because it's more work too, right? It's more work.
it is more.
It's
I
much
I
easier to
was
open a
used.
box.
Yes, but I will tell you, I mean,
But it's habit, right,
it is habit.
Aruna? It's habit. I have changed so many, even my eating habits. I don't eat like sugar, fried foods. The only thing I eat here and there is fries because I love them. But I avoid all of them. Alcohol, very little alcohol. I do exercise. I mean, I try, but I'm sure I'm still making huge mistakes. Like cheese. You talked about cheese, and I went, oh. If my husband were here, he would go, "Oh, she can't do that," because I love cheese and all of that, and I really
Well,
don't
let me
have
tell
any
you, if
reaction.
the food that you love is probably the one that's causing you the most harm. That's what we see. So when you say, "Oh
Really?
no, I'm not," yes, sorry,
That's bad news.
but again, it's not that you're eliminating it forever. It's temporary.
Of course,
It's
yeah, yeah.
only to restore your gut lining,
Okay.
and then go to good sources of the cheese. Once you
Mhm.
eliminate and then you reintroduce, that's when, if you can, if it's a good food, truly a good food for you, you will you will enjoy the food and it will not cause you any
Yeah.
problems.
Yeah,
But
let me ask you just one more thing because I want to help those who are thinking about, okay, so how can I taper off? Of course, they're not doing it on their own because they have to do it with a doctor if they're taking psychiatric medication. But what does it look like usually? Because it's a very scary thing. I know because I've taken psychiatric medication, only took it for 10 months for depression after my father's suicide. So I struggled with that and it helped me at the time. And I tapered off and never went back to it again. That was like almost 20 years ago. But I have a sister, for example, that she's tried to get off medication. She's been
mm-hmm.
since my dad's death, she's been
Mm-hmm.
taking psychiatric medication for, I don't know, almost 20 years now. And she's tried, but you know how it is. You stop 3 days later, you are like immobile, in bed,
That's
in a black
yes,
hole, right?
yes.
And it's really
So
hard.
that
And then
is
she
the
goes, "Yeah,
evidence
I
of
can't stop. See, I can't stop because it." I said, "No, maybe you
that
can,
is
but you don't know
withdrawal.
how." right?
Yes, but that is withdrawal. So what your
Yeah.
sister is going through is actually withdrawal. That's what's happening there. That's why I
Uh-huh.
say that these medications are very habit forming. They're no different from alcohol and opiates and all those other medications.
Hmm.
And in especially antidepressants, very, very real increase in
Addictive and
not only
addictive.
addictive, but they do increase suicidality. There is
They
no doubt.
do. Yeah. I mean, even that now it has to be on their labels, right? Finally, after years and years and years, uh,
Yes.
the I think it's
Yeah.
FDA.
Yeah.
Yeah,
There's a
they
black box warning.
it's yeah, it
But
has to
yeah,
be as a warning, which
yeah,
never makes sense, right? I mean, how can you think that something's fighting theoretically depression, but it's going to increase in suicidality? How does that make any sense?
because it is such a actually the process is actually through a side effect called akathisia.
Hmm. What is
That's what
that?
akathisia is, a side effect that is very specific to different psychiatric medications, antidepressants and psychotic medications, all of these things. And what happens with akathisia is that intense anxiety and restlessness, where the people feel like they're jumping out of their skin,
Hmm.
and they become almost psychotic and bizarre in their behavior. Like I
Hmm.
just last week I saw a patient who took Prozac for 5 days
Hmm.
and he was having akathisia and he became suicidal.
Hmm.
But in this state of akathisia, people can also become homicidal. See, that
Wow.
is the other thing that people don't talk about. These are the but Peter Gosha, the Danish physician, he has done lots of YouTube videos. He's been interviewed extensively. He's a statistician physician, and so
Mm-hmm.
he's done tons of meta-analysis, and that's why he says that almost all psychiatric medications should be banned, is what he
Mm.
says.
Oh
So
my God.
yeah.
That's
But
so
to answer your
worrisome.
question,
Uh-huh.
taper can only happen after there is some improvement in the physiological functioning, in the inflammation,
Mm-hmm.
nutritional status is improved, detoxification. All of this needs to happen for a month or so before we can start. And when I start the taper, number one is that I prepare the person to have the right attitude. No fear. If you're afraid, it's not going to work out.
Mm.
It's mind over matter. So we work on reducing the sympathetic arousal. We
Mm-hmm.
teach staying in that parasympathetic state. And then when we initiate the taper, the patient is in charge. I'm just kind of making sure that everything is okay. The patient is in the driver's seat.
Mm-hmm.
So the patient tells me, yeah, I'm tolerating this. I mean, once the patient gets the feel for how it is, how much they can tolerate, and so sometimes we do it every week. I mean, some of my patients are like, nope, I'm done. I don't want to take this anymore. And very quickly they go through the taper process.
Mm-hmm.
Whereas for some others who are maybe want to be a little bit more cautious, it will take like anxious. I mean, this old, I
Yeah.
mean, my 72-year-old patient, she was very anxious. So we took our time with it. But
Of course.
ultimately,
Yeah.
she's off of that. And
Mm-hmm.
I haven't seen her in almost, I want to say 4 or 5 months, which is a good thing. She's doing well.
Yeah. Yeah.
So,
Cool. Yeah, it sounds like you have to take care. First of all, as you said, take care of your body. You have to prepare your body to be healthy, so that you can get rid of that medication and take care of itself,
yes.
on its own, right?
Yes.
And
Yeah.
then psychologically prepare, because it is something we humans, we love control, right? Or the illusion of control, because that's what it is. Nobody
Mhm.
controls anything. But anything, the idea that you taking that medication every day, you will be fine, and you're taking care of your health, and you'll be feeling better, and it's actually treatment. The moment you stop, that's a scary thing, right?
Yes. Yeah.
And it goes against everything that we hear from this culture, right? So
Yeah.
you really have to get rid of your fears too.
Yes. Yeah.
Well, Dr. Tumala, we have to stop, but I would love to stay with you, because this is a topic that I
Yes.
love. Because
Thank you so
I worry
much.
so much about my patients. They come to me with all this mental health, and it's just substituting one by no, I'm okay with the depression, but now I'm anxious. And then they take something for the anxiety, and they go, no, I think now I'm a bipolar actually. And then they're taking something else for that because someone gives them, and they just
Majority
pile
of
up. pile up on
Yes.
substances and chemicals. And I remember a client that I had every time she came in. Every week it was a new psychiatrist. Oh, I don't think this one is working. I think I need to just change my it's all she talked about. It was the medication. And she always came in with this huge diet coke that she was drinking all day. And I'm
Mm.
looking at her, so, oh my God. It's so I worry about them because
Yeah.
it's the
Yeah.
message we get, right? So cultural.
And also from the physicians. I mean, that used to be one patient that I worked with back in 2006 in my residency. Also, she had PTSD. There was no question about that. Very
Mm-hmm.
traumatic childhood, very obese.
Mm-hmm.
And every week she would come into the session with a can of the orange soda,
Mm.
I don't know, the
Fanta, Fanta.
Fanta, with how many ever grams of sugar. And she would go in and she was getting ready to get a bariatric surgery, which I'm totally against, because that, everything is, all our health and disease comes from the gut, and you go and chop up the gut in God knows how many ways. How is it going
Mm.
to help? So, and I was like, why don't you drink water? And she's like, oh, water doesn't taste good. That's why I drink Fanta. This is how I keep myself hydrated. And I'm like, no, all that sugar is actually going to make you pee more, because it
Mm-hmm.
increases the osmolarity, and you pee more when you drink concentrated liquid. So it's but interestingly, her other, even her bariatric, I mean, I don't know, they were not giving the dietary advice first. And I think this is a problem on the part of physicians, where we think that, oh, the patient may not do it, it's too much for the patient to, like when I say you have to change your diet, eat organic, and some of my colleagues will say, oh, but that's, I work with inner city population, they cannot afford organic. I'm like, how do you know?
Mm-hmm.
I don't know that. Who am I to decide my patients' preferences when it comes to their spending habits? My
Mm-hmm.
job is to give them the information,
Mm-hmm.
get them to decide how they're going to live their life,
Yeah.
right? So these are
Well,
some things that as physicians we have to change our thinking around.
yeah, and I don't even want to go there because I'm sure you have some horror stories on how hard it was for you to finish your, I don't know if it was doctorate or whatever here, the kind of pushback that you received.
It
And
was awful, yeah.
I can imagine. I'm not going there because that's another whole episode.
No,
I'm
but
sure you
even
have
that,
horror stories.
I did, and it was a traumatic experience. But because of that, that there was a silver lining out of the trauma. If I had not experienced that, I wouldn't have left and started my practice, where I have full freedom and innovation. I
Mm-hmm.
don't have to, I'm not, you know, the only person I answer to is the patient in front of me,
Yeah,
not
thank
the
God.
insurance
Yeah, I'm
company,
very
not the
thankful for that.
administration.
Yeah, that's
Yeah.
yeah. I remember one of the stories you told me, but we're not gonna go there. But it was traumatic. I mean, if you don't prescribe medication, it's liability because that's what this country is all about. It's liability. So if
Hmm.
it's liability, you can't work here because you have to prescribe. You have to say, you have to show that you did something, right?
Hmm. Exactly.
Anyway, Aruna, thank you so much for your time. And
Thank you,
I
Paula.
hope
Thanks for
my
having me.
listeners take at least the first step and do some research. I'll have as many links as I can on my notes to help them. But and if they want to find you, I'll have your telephone number, your contacts, and everything. And I hope some of them will contact you. And I might even contact you for that because I'm sure I need to change a few things. So
You're very.
thank you so much for this time and for helping me and my listeners.
Thank you for having me. It's been my pleasure.
Well, I'm going to stop recording now so we can talk.
Yes.